remiss if I didn't ask you about the famous Dr. Hagen wash, which I think your daddy invented way back, right?
The sinus wash was developed by Sir Arthur Pretz in the 1800s. It's called the Pretz. And it's interesting that the more things change, the more they stay the same. Up until the 1950s, we didn't have high-powered antibiotics, all of the steroids we have today. The allergy sprays, Flonase, the allergy medications like Allegras and Claritins and Zyrtex. So they had to topically decongest the nose with basically what would be an Afrin and then wash the sinuses out. And we've often talked about why doctors would not wash the sinuses, those that were trained in the 1970s, 80s, 90s, and the 2000s, because it was always believed that the high-powered antibiotics, the high-powered steroids, the antihistamine decongestants would take care of the problem. So washing sinuses was not taught over the last 50 years in training programs. The only reason we've done it is because we had a father that came to town in 1958 and he did this. And what's amazing how the more things change, the more they stay the same. Well, once resistant bacteria started becoming a problem from high-powered antibiotics, or steroids can cause side effects, and all the medications that people were trained over the last 40 years may not be working, well, guess what? We're back to washing sinuses. And it's not that physicians are being trained in their training programs. There are companies that are advertising directly to the consumers about wash your own sinuses at home. I've always been a fan of people irrigating their own nose, but with like a saline bottle that they get at the pharmacy. It's sterile, you don't share it with other people, and when you finish it, you throw it away. But at least the saline bottle came from a pharmacy. We wash people's sinuses out, but it's interesting that irrigating sinuses has taken a full circle and come back, because we're trying to limit the amount of antibiotics we give so we don't create resistant bacteria. We're trying to limit the amount of steroids we give people. So it's just amazing that the way things were done 50 to 100 years ago are still holding up as sound principles.